Hi, and welcome to a presentation by Nadine, Gardiner. The following is on the manubrium of the sternum. This presentation will cover the structure and function of the manubrium, its location, and relationship with surrounding bony landmarks and muscles. Structure and function. The manubrium is part of the thoracic cage. The thoracic cage is composed of the thoracic vertebrae posteriorly, the ribs laterally, and the sternum and costal cartilages anteriorly. Together they have the important function of protecting the heart, lungs, and important blood vessels. They support the shoulder girdle and upper limbs, and aid, with the help of the intercostal muscles, in alleviating and depressing the thorax during breathing. More specifically, the manubrium is superficial to the left brachiocephalic vein and the left common carotid artery. The manubrium, a flat bone, is the broad superior structure of the sternum. The manubrium is approximately 4 cm long and lies at the levels of T3 and T4. It lies anteriorly at the midline of the body's thoracic region, just deep to the fascia, making it easily palpable. It has a quadrilangular shape, narrowing from the top, which gives it 4 borders. The suprasternal jugular notch is immediately located at the superior broadest part of the manubrium. This notch is intermediate to the 2 distal clavicular bones. The clavicles meet the manubrium at the concave clavicular notches to form the sternoclavicular joint, the only joint of the skeletal attachment between the pectoral girdle of the shoulder and the axial skeleton of the thorax. The inferior part of the manubrium articulates with the body of the sternum to form the manubriosternal joint, known as the sternal angle. This border, oval and rough, is covered with a thin layer of cartilage for articulation with the body. A slight posterior bend in the sternum can be felt through the skin and serves as an important anatomical landmark. Slight indentations on the lateral sides of the manubrium provide attachment points for the costal cartilages of the ribs. The lateral borders are each marked above by a depression for the first costal cartilage and below by a small facet, which, with a similar facet on the upper angle of the body, forms a notch for the reception of the costal cartilage of the second rib. Between the depression for the first costal cartilage and the demifacet for the second is a narrow curved edge which slopes from above downwards towards the midline. Several important muscles attach via tendons to the manubrium, including the sternocleidomastoid, the pectoralis major, the sternohyoid, and the sternothioid muscles. These will be discussed in the following slides. The sternocleidomastoid muscle has 2 heads of origin. The sternal head arises from the anterior surface of the manubrium of the sternum. The clavicular head arises from the superior surface of the medial third of the clavicle. The pectoralis major. The pectoralis major muscle originates from the sternal half of the clavicular and the manubrium and the upper body of the sternum, and the aponeurosis of the external abdominal oblique muscle. The sternohyoid and sternothioid both originate at the posterior surface of the manubrium and the first costal cartilage. And that concludes my presentation on the manubrium. Thanks for watching.